Hi, good afternoon, friends. Pradeep Pindyala, your buddy, the professor of anesthesiology. Today, I'm going to talk something very, very special and a very important thing. It's how to save a baby when the mother of the baby has suddenly had a cardiac arrest or died. How to save the baby and how to resuscitate the baby. And this entire exercise is known as PMCD. What is PMCD? Perimortem Cesarean Delivery. The very purpose is to facilitate resuscitation. You believe it or not, if you remove the child as early as possible from a dead mother who had just arrested, the chances of resuscitation is hugely improved. If you keep on doing resuscitation with a pregnant lady who just before cesarean or during cesarean section, it's very difficult procedure to resuscitate. But if you remove the child as early as possible, you can facilitate the resuscitation also. The most important thing is very obvious. The aortic cable compression decreases, isn't it? So that's how it facilitates the resuscitation of the mother also, and the baby also. Neurological deficit doesn't come if you extract the baby within 4 to 5 minutes after the death of the mother. Initially, you try to resuscitate the mother for 2 to 3 minutes. If you don't resuscitate, if you fail to resuscitate, the best option is to extract the baby immediately. Don't wait for surgical instruments arrival, and you don't have to take the mother to the operation theatre. Wherever the death has taken place, even in the ICU or in general ward or any ward, the moment you saw that there is a pregnant lady who has a viable child and definitely more than 20 or 24 weeks of pregnancy, try to do immediate cesarean section yourself. Very, very simple. Let me tell you the procedure, which is very, very simple. What you need is just a scalpel, no need of surgical instrument and no need of operation theatre. PMCD, Perimortem Cesarean Delivery, will save both the mother and the child if it is done within 5 minutes. Okay, let me tell you about the procedure. It's very simple. Make an incision from xiphoid to symphysis pubis, including all the layers of the abdominal wall at one go. A second vertical incision from the fundus towards the urinary bladder without injuring the fetus. And extract the fetus as early as possible. Perimortem cesarean section, as I had mentioned, is the surgical delivery of the fetus performed at or after the death of the mother. There is no clear guidelines as of now about the procedure, or is there any data regarding the optimal time for the delivery after the arrest of the mother. So you have to do it as early as possible, preferably before 5 minutes, to make a proper resuscitation of the mother, because the resuscitation is much better after the extraction of the child. And you will have a child without neurological damage from anoxia, because early delivery of the baby has been done. The very purpose is to facilitate resuscitation of the mother as well as the baby and save the child by doing perimortem cesarean delivery. Have a wonderful day. Thanks for patient listening, and wish you all a Merry Christmas and a Happy New Year in advance. Bye-bye.